Hey, it's Dr. Lewis Clark. I want to thank you for taking time to watch this video about your brain. Okay, so I hope you're interested in your brain. I know I am. I'm interested in my brain, but I'm also interested in your brain and your brain working normally, optimally, and not premature degenerating or developing what's called cognitive decline. So I'm going to give you, go through a series of videos with you to explain different areas of the brain, how to know what kind of symptoms may be indicating that you have a problem in that area, and also I'm going to give you some interventions, some things that you can do even at home to begin to rehab if you have some of these problems, some of these symptoms, okay? So the first part of the brain we're going to focus on is the little brain. It's also called, in the back part here, called the cerebellum. Now, the cerebellum is a highly intensive part of the body, but of the brain even. So the brain only makes up 10% of your body's mass, but it consumes 30 to 50% of all the energy that your body produces. So the brain in itself is a highly energetic, demanding organ. But the cerebellum even more so, because the cerebellum only makes up 50% of 10% of the brain, but it has 50% of all the neurons that are in the brain. So there are three parts to it. We're going to focus on one of the parts today, or three different areas of the cerebellum. There is the vestibulocerebellum, the spinocerebellar, and then there is the cerebrocerebellum. And we're going to focus on the vestibulocerebellar today, okay? And so if you have problems in this area of the brain, here are some of the common symptoms that you may notice. Number one is feeling dizzy or off balance. Number two is you may have chronic tightness in your spine or back or neck pain. You may also get car sickness very easy, seasick, anything like that where there's a lot of movement. And you can even develop like anxiety in crowds or a place where there's a whole lot of activity and movement. And the reason for that is because your cerebellum is working with your eyes and with your ear canals and other joints of the body to tell your brain where your body is in space. And if there becomes a mismatch of that information, if it's not all exactly accurate and doesn't fit together, then you begin to feel off. And so what can we do about it? There's a couple things I'm going to give you today that can be done. You could even try at home to see if it improves your situation. And I've got Dr. Angie Franco here with me today. She's going to be my patient that we're going to work on here. And I'm going to show you the first thing, which is called the OPK strips, okay? And this can be got from an app online. If you have an iPhone, it's called OKN strips. There's several of them, OptiDrum, a number of others. If you just go to your app store and search for OKN or OPK, you'll find one of these things to come up, okay? And so here's how it goes. So this activates a reflex with the eyes. And all Dr. Franco is going to do is just look at the red squares, and I'm going to move the strip across. And then we come back the other way, just like that. And if you could notice, when I do that, we'll do that one more time just to make sure you get that. That's great, by the way. Her brain's working well. Okay, so that's good. And that's all you have to do. It does it on its own, and you'll see the eyes look like a windshield wiper. They're going back and forth. The reason for that, partly, is because of the cerebellum. Now, there's other things involved there. The parietal lobe's involved, and the frontal lobe are involved as well. So that's the OKN or OPK strips. Back and forth. I recommend you do them horizontal first and do it for about 30 seconds to a minute and see how you feel. And then maybe repeat that 3 to 5 times per day. The other thing, and this is a really big one we use with our patients in the office a lot, is what's called VORs, vestibular ocular reflex exercises. This helps get your spine and your eyes and your ear canals back on track again and get those back to working together. And so the way you would do this is we would have this mounted on the wall at home somewhere about eye level, and then we would have the patient look at the A, which is in the center, which you can see here, and then turn their head to the right and then to the left. Yeah, it doesn't matter which way you go first, but just go about 45 degrees is where you start at, and you keep your eyes right there. And then once you've done that, you do that, then you go up and down. And so again, keeping your eyes on the A, keeping your eyes locked on a target with your head moving. When you get where you can do this, and there's advanced ways you can do it, then you do it diagonal, then you begin to do it standing with your feet together, and then even in a tandem stance to develop and rehabilitate this system better. But these are two great activities that you can try at home if you're suffering with any type of those symptoms that we mentioned. And so next time we meet, we're going to talk about the spinocerebellar function, and we'll talk about some things that you can do there as well. And until then, live life well, and God bless.